And there you go. Medyo nabitin ako sa discussion ng ventral cavity. Medyo nakat ka na. Let's continue. Your ventral cavity, I'll repeat, is divided into two. We have your superior, which contains your thoracic cavity, and your inferior, which includes your abdominopelvic cavity. Okay, isa-isahin natin yan, guys. Your thoracic cavity. Yan, wait lang. Okay, oops, asan na ba? Okay, your thoracic cavity can be divided into, taas natin ha, your ventral cavity divided into two. Superior, ano yung superior? Thoracic cavity. Ano yung isa? Abdominopelvic cavity. Tataas lang natin. Okay, your thoracic cavity. Your thoracic cavity can be divided into the left. Okay, into the left and right. Naka-anatomical position. Your left and the right pleural cavities. They are divided into two. Your left and the right. Ay, sorry, hindi pala kita. Your left and the right pleural cavities. Okay, your pleural cavities. Pleural cavities. And the central, okay, ito, yung nasa central part, okay, that is your pericardial cavity. Okay, ano naman to? That is your pericardial cavity. Structure ang pinag-usapan natin dyan, ha. And yung the pleural cavity contains, ito, the pleural cavity contains your lungs. Okay? The pericardial contains the left and right pleural cavities. It contains your contains your lungs. Yung pericardial contains the heart. Okay, thoracic cavity. Thoracic cavity can be divided into two. Yung right tsaka yung left pleural cavities. Ano yung laman ng pleural cavities mo? Yung lungs. Yung pericardial cavity na yan, ano yung laman niya? Heart. Okay, nakikita nyo ba yung kulay, ano na yan? Lavender. Siyempre hindi pa nakikita kasi wala pang kulay. Charlie, ayan. Yung kulay na yan. Ano naman ang tawag nyo dyan, class? Okay, para malaman mo lang yung structure niya kasi importante yan. Yan yung tinatawag nating, okay, mediastinum. Okay, mediastinum. Yan. Okay, I'll repeat, your thoracic cavity, nadidivide yan sa dalawa. Yung left and right pleural cavities contains your lungs, tsaka yung pericardial cavity contains your heart. Going back to your abdominopelvic cavity. Tatas natin. Abdominopelvic cavity. Okay, your abdominopelvic cavity. Ito, thoracic area to. Abdominopelvic cavity. Okay? Yung na-stroke. Okay? Abdominopelvic cavity can be divided into superior abdominal cavity. Ito. Okay. Yung ating tinatawag na abdominal cavity. Abdominal cavity. Tsaka yung ating tinatawag na yan, abdominal lang yan, abdominal. Okay, tapos yung ating, Diyos ko, magsiselect lang ng kulay. Okay, ito, oops, hindi ko masyadong makita, sir. Okay, this area, ano yan? Yan naman yung ating tinatawag na your pelvic area. Okay, your pelvic area. Pelvic cavity. Okay, your pelvic cavity. Your abdominal cavity, your abdominal cavity contains your stomach, your liver, your spleen, your kidneys, small intestine, and most large intestine. Sulat natin, guys. Okay, your abdominal cavity contains what organs? Your stomach, okay, your liver, your spleen, okay, your kidneys, spleen, your kidneys, your small, okay, and mostly your large intestine, Whereas your pelvic cavity, tataas lang, dun na lang. Pelvic cavity contains your bladder, okay, your bladder, and your internal reproductive organs. Your internal reproductive organ. Like your uterus, your cervix. Okay? O, para mas malinaw, tignan natin yung ating drawing na mas malinaw po dyan. Tignan natin. Let's check the PowerPoint. Okay? Bago yan, dito muna tayo. Your serous membrane. Just an overview lang. Okay, we already discussed your cavities. Okay? Your line trunk cavities, it covers your organ structure. Okay, anong tawag mo yung nagko-cover sa organ? Anong tawag dyan? Visceral. Your serous membrane. Visceral serous membrane. The outer membrane is the parietal. Okay, na-discuss na natin yung cavity kanina. Inaano lang natin. Okay? Look at this. Okay, look at the figure. Yung fist na yan, okay, yung fist na yan, kunwari yan yung organ. Ito yung cavity. Ano yung cavity again? Fluid-filled space between the membranes. Okay? Yung ating covering ng organ, covers the organ, ito, ang tawag dyan sa part na yan is visceral. Okay? Yung outer balloon wall, okay? Anong tawag dyan? Yung outer membrane, that's your parietal. Yung inner that covers the organ, visceral. Okay? Para mas makita lang natin mas malinaw. There are three sets of serous membrane and cavities. Okay, we have your pericardium. Kanina sabi ko that's around the heart. Pleural cavity, lungs. Pericardial cavity, heart. Ayan no, kanina, 'di ba? Nuulit ko lang. Pleural cavity, your lungs. Your peritoneum, that's around the abdominopelvic cavity, that's your peritoneal cavity. And then, your pericardium, ayan, yung ating tinatawag na figure 1.15a, covers the heart, yun yung visceral area. Okay, this is a thick fibrous, that's your parietal, and pericardial cavity, it reduces your friction to your heart. Ganito. Okay, so this is your heart, obviously, that is your heart. Laging nasasaktan pag iniiwan ka. Okay, and then ito yung ating tinatawag na yung kulay white na yan, that's your pericardial fluid that reduces the friction. Okay. Ito, yung lining ng heart na yan, wait lang, gagamit na ng ibang kulay kasi red din yun, tas red din, sir. Kitang-kita, sir. Okay, ayan. Ito, yung covering ng heart na yan, covers the heart. Kikita nyo ba? Ayan. Ayan. Anong tawag dyan, class? Visceral. Visceral. Okay, covers the heart. Yung sa may inner part. Yung thick fibrous that is outer, yung nasa labas. Okay. Anong gagamitin natin? Blue, sir. Blue. Ayan. Ayan. Kikita nyo yan sa outer part. Ayan, outer part, yan yung parietal. Okay? Your pleura, pleural cavity, visceral pleura, it covers the lungs. Okay, ganun din. Ayan no, yung ayan na part, yan yung area. Visceral yan. Visceral. Okay, ito. Ayan, visceral part yan. Yung sa labas, anong tawag dyan? Visceral or parietal? Parietal. Okay, yung kulay white na yan, that's your pleural cavity containing pleural fluid. Okay? So, ayan yan. Your peritoneum. Inuulit lang natin. Okay? Visceral peritoneum. Ganun pa rin. Okay? Visceral peritoneum. Ayan. Ito. Pak. Oops. Ayun. Okay? Yung parietal, hindi na nakikita. Yung sa labas. Okay. Buburahin natin. Oops. Ay, ayaw magburat eh. Parang ayaw din makalimot. Ayan. Ito. Yung kulay blue na yan, guys. Yung sa labas, that's parietal. Yung lining na to, ayan. Ayan. Nakikita nyo yan. Yung lining na yan. Okay, yan yung visceral. Parang dun yung sa heart natin. This is your mesenteries. Yan. Mga yan. Okay, that is your mesentery. Now, we go to the subdivisions of your abdomen. Yung nakita natin kanina. Okay, the subdivisions of your abdomen is divided into 4 equal quadrants. Okay? Remember again your anatomical position. Ulitin ko na naman. Anatomical position para same orientation tayo, class, para hindi natin nakakalimutan. Okay? The face is forward. Okay, arm at the side. Okay? Arm at the side. Palms facing forward. Feet slightly apart. Nakaharap yan. So, yung anatomical position mo, ang gagamitin mo doon, hindi yung kung ano yung position ng observer. Tama? O, ito, observer ako. Ito, sa akin, left ko to. Pero pag sa anatomy yan, yan yung right. So, this is your division, yung quadrant. Hatiin mo yan ngayon sa 4. Hatiin mo sa 4. Ayan. Yung sa taas, of course, that's your upper. Yung sa baba, lower. This is your right upper quadrant. Okay? So, this is your left upper quadrant. Left upper quadrant. Uulitin ko ha. Ito kasi, pag ikaw yung observer, left mo to. Pero sa pag anatomical position, para same orientation, right yan. Right upper quadrant. This is the right lower quadrant. This is the left lower quadrant. Furthermore, dividing that into different regions, kasi quadrant yan, there are 4 quadrants. Okay, there are 9 regions. So, this is your right hypochondriac region. Okay, right hypochondriac. This is your epigastric pain. Kaya, pag may nakita kayo doon na assessment, when the patients complain, okay, what type of complaint yan? Epigastric pain. Ayan, dyan sa may gitna. And your left hypochondriac region, your right lumbar, umbilical region, left lumbar, right iliac region, hypogastric region, and your left iliac region. That's very important.